Hello, I'm Dr. Maria Sulindro, specialized in integrative anti-aging medicine, practicing in Pasadena, California. Today, I would like to discuss about anxiety. I'm going to share with you what my office will offer when a patient comes and presented with anxiety disorder or panic attack. We are practicing integrative medicine or modern medicine, so it's a little different than traditional or conventional medicine. I will first explain to you what anxiety is, the symptoms, and the common treatment. Anxiety disorder is a condition where people frequently have an intense, persistent, and excessive fear or worry about some situations. Some patients have episodes of sudden fear or terror that reach a peak within minutes, and it is called panic attacks. This feeling is out of proportion and lasts a significant long of time to the patient. This can start during childhood or grow more intense to the adult age. Common anxiety symptoms. These patients feel nervous, stressed, tense, afraid of danger, and create panic situations. Physical symptoms include increase of heart rate, fast breathing, sweat, and sometimes tremble, tired, weakness, and weakness can come out of a sudden. It's very uncomfortable. I hope you have never felt this way, but if you do, that is panic attack. And then you will probably describe, I went into a panic situations. So panic is a common word and anxiety is a common word. But I'm talking about not the usual anxiety because everyone will have anxiety in daily stress activities. You also can develop anxiety. But this anxiety disorder, they have problem concentrating in their work, worry about specific things. They develop gastrointestinal discomfort. Some develop insomnia. They cannot sleep at night. Patient cannot control the anxiety feelings. And often they have social withdrawal. There are different types of anxiety disorder. Some people call it agoraphobia. This is those people who are afraid of space or places or becomes panic when they're at a certain height, okay? And then anxiety disorder due to their own medical problem also exists. They're afraid of their own condition. Or panic disorder of this can also caused by phobia, like phobia of animals or phobia of a certain things. Some people their phobia of looking at many dots or looking at a certain shape, like insects, like any insects. So and some type is called specific or selective mutism, and the children usually don't talk in school, but they speak at home. Separation anxiety disorder is for those who are having symptoms when they are separated from their parents, or adults who are thinking about their parents are getting old and they're going to die soon. Or social phobia or social anxiety disorder, those who feel embarrassed, self-conscious, viewed negatively by their peers. Substance-induced anxiety. Now, this one is exposed when they are exposed to a certain toxic substance and they do not know that they are very sensitive, And they can also experience symptoms of anxiety when they are withdrawing from a certain drugs. What's the cause of this anxiety disorder? The cause is not fully understood. No one or no scientist can pinpoint the cause. It can be life experience or traumatic events appears to trigger this anxiety disorder. This usually in people who are already prone to anxiety. Or inherited traits also can be a factor, like a family that has someone uh, commonly become panicky. But recently, we found out in the last maybe 15 years that a certain genetic traits like the MTHFR traits, they do have difficulties in metabolizing or methylating folic acid and cobalamin, which is vitamin B9 and vitamin B12. And these people need a little booster for their brain so they don't go into this anxiety disorder, or they can also become uh, actually lost some memory. They become like stressful and depressed. Medical cause can cause anxiety, and for some reason it is linked to unhealthy health situations. For example of this unhealthy health situation can include heart disease, diabetes, thyroid problems, usually hyperthyroidism, respiratory disorder, which is called chronic obstructive pulmonary disease, where they can uh, induce hypoxygen in their brain and they become panic. Also, asthma situations, people who misuse drugs and they go into drug withdrawal. Chronic pain or irritable bowel syndrome can also cause anxiety. Some rare tumors that grow and affects the certain hormone production can cause it's called fight or flight situations. What about risk factors? Risk factors can be like half a dozen of it. Let me mention some. Trauma. Children or adult who endured abuse or trauma or witnessed traumatic events are at high risk of anxiety disorder. Stress due to illness or even stress when they care for people who are ill for a long time. Maybe spouse taking care of their chronically ill that are that the spouse will die soon. They keep thinking, and that can induce a panic attack, sometimes depression. Stress build up, such as death in the family, also is a very severe stress and can induce a panic disorder or anxiety disorder. Personality disorder is people with certain personality traits or types are more prone to anxiety disorder than others are. Other mental health disorder such as depressions, having blood relatives with anxiety disorders like family members, okay? I already explained. This can run in the family. Drugs or alcohol. Drugs or alcohol use in a excessive or misuse of the dosage can cause withdrawal and worsen the anxiety situation. Can anxiety disorder cause complication? Yes. This can cause severe headache, depression, chronic pain in substance abuse use. That people who use, let's say for the pain, they abuse it, and this one can also, uh, for anxiety, and they can cause also digestive and bowel disorder. So complication of anxiety can also happen at works, school, and it can create a social isolations. Insomnia is very common in anxiety disorder. Poor quality of life will will then it will create a poor quality of life, and it can also lead to a bad situation, which is suicide. They're suicidal. What's prevention? Can we prevent this anxiety or panic disorder? Yes, you can. So make sure you're active with your social life. If you know you're prone to anxiety, or don't forget you have family, so family life. And also make sure you tell your doctor when you feel you are not feeling good at all. Avoid alcohol and drug abuse. Avoid that because it will make it worse. Have your doctor test you, so psychological testing, to see maybe there is an underlying disease such as depression just now. The usual treatment for anxiety disorder is a combination of psychotherapy and medication. These two will give the most benefit. The psychotherapy, also known as talk therapy or psychological counseling. Psychotherapy involves working with the therapist to reduce your anxiety symptoms. That can also consist of cognitive behavioral therapy or CBT is the most effective forms of psychotherapy for this anxiety disorder. This is a therapy that teaches you positive thinking. It's good for everyone actually, but especially for people that has anxiety, they teach you and they give you what kind of thinking you have to select and keep thinking about it until your anxiety disappear. Learn the skill to improve your symptoms and gradually return to the normal activity that you have been avoiding it because of the anxiety. Let me let's take some questions. How long before the treatment works? Well, it varies. Some works really fast, but some take a while. So it is depend on the individual. Many would feel like after like they feel better, they don't take their medication, but that is wrong because this anxiety sometimes is a condition of lack of certain vitamins. Remember the MTHFR, that is lack of folate. So you have to take it for life, for example, because your body is not able to create this methylated folate or methylated cobalamin, B9 or B12. Okay. Medication. In a conventional therapy, the medication that are used usually is antidepressant, and there is one called buspirone. This can be prescribed, and sedative like benzodiazepine or beta blockers, not intended for a long-term use, but it can help for a short-term use. Lifestyle and home remedies can also be in the treatment program, such as, um, oh, I'm sorry, lifestyle. Okay, you have to continue your regular lifestyle or active lifestyle. The home remedies, most of them they also helps. I'll tell you which one. Most patients continue their daily physical activities, and I would recommend exercise because daily exercise will really help. And we already said that to avoid alcohol and recreational drugs. For people who are smoking, maybe it's good to quit smoking and they eat balanced diet. Stress management and learn how to relax. All of the above then eventually can help their insomnia or their sleep. Now, this is really what we suggest besides the psychotherapy and medication. Those patients who come to us, we go through all these questionnaires. To include alternative medicine like homeopathics, we have to be very careful because it can be an interaction with the medication or drugs. Otherwise, we use alternative medicine. So when they come and their main complaint is anxiety, I ask several questions, including family history, if they have a family members that have anxiety, and then I will prescribe laboratorium requests or childhood trauma, abuse, separation, divorce, So this person usually fail to accept it. Is there family support? That is very important. And are they being bullied at school or at work? This is very common now, especially when you're not having the same mind or thinking. Sometimes they can bully you. Other medical problem also I include in the questionnaires, so that diabetic, hypertension, cancer, or serious problem that can be fatal. And then what kind of stress, and then we uh, treat them appropriately. I usually also emphasize on that CBT or cognitive behavioral therapy, that I teach the patient to recognize that this is part of their stress and anxiety and it is a fear, so they recognize it. And then I check some of the possible epigenetic and genetic factors. So we can do that through the blood test or saliva testing, or if they can afford the non-covered by insurance, then we do the epigenetics or genomics. If there is an epigenetic factors, then those are like toxin, then we initiate detox to make the body more stable and work properly. When there is a poor diet, such as eating non-balanced food or processed food, we evaluate and give the patients proper advice. Insufficient of antioxidant, mineral, essential fatty acid, amino acid, even vitamins, we supplement it accordingly. We can actually test on this, so we know, because otherwise you'll be supplementing too many for unknown reason. I usually test it. Then we retest every 6 to 12 months, okay? And when stable already, then we test it, no, when it's stable, we test it every 6 to 12 months, but otherwise we test every 8 to 12 weeks until they become stable. Some patient has a very significant stress, and many of them also went into adrenal fatigue. Then we treat the adrenal fatigue. We balance also the hormone. And for those who need exercise, we suggest a plan. We emphasize very much on social support. In many cases, the patients do not have to be on antidepressant. However, it is best to see psychologists for proper diagnosis and also talk therapy, which then they learn about the CBT, cognitive behavioral therapy. Patients with insomnia must be taken care first so they can rest properly and they improve their situations. And for the genetic mutation, we talked about already the MTHFR, which is methyl tetrahydroxyl folic reductase. They are lacking of this enzyme. So then we add and help them with the extra methylated folate or B9 or extra methylcobalamin or B12. We usually hydrate them with infusions of vitamins and minerals. Some patient improves in a very short time, like maybe days, but many will go to weeks. In severe case like phobia, they are very challenging. For example, agoraphobia, afraid of height. The immunization therapy is one of the option therapy. That means they have to be willing to practice to go on a certain height. But if you are phobia of height, you won't be doing that. So it's very challenging. I have a patient who is phobia on certain animals, like mouse or snake or roaches. The patient has to be exposed to these animals. And that is called immunization therapy. It's not vaccine, okay? It's just you have to be exposed to whatever you're afraid of. But phobia is intense. And then it's not like vaccine, you just have a reaction of the vaccine. But these people who are afraid of these animals, when they see the animals, they go into their panic attacks, their anxiety attacks. So which is very difficult. This is a challenge. Usually they live with this one and with this situation or condition until they die. But what they do is they avoid. So they avoid those animals. But if they can be hypnotized and doing the immunization therapy or exposure therapy, it can be very successful for some reason. Because some people are not afraid of mouse or rats. I'm not. I can touch them and I can look at them. I look at the picture. Sometimes they're very cute. Not Mickey Mouse, but it's a real mouse. But many people, they cannot even open this book that has a picture of mouse. They have anxiety. So that's what I'm talking about. So we have a few more questions, I think. A moment. Yes, thank you for the lecture. There are many anxious people during this time of COVID. Yes, and fortunately, the anxious people, the regular anxiety, you can handle it with, for example, exercise or daily living activities. But many of this anxiety, you have to handle it with either homeopathics, certain supplements, and also medications. And if it's short term, it's okay. No, I agree. This COVID create a lot of anxiety. So another question is, do you take patient with abuse history? I usually refer them to a psychotherapy and also psychiatrist both if it's very severe. And the last question is, what kind of tests do you do? What kind of tests do you do for epigenetic? I think I have a YouTube video that talks about epigenetic. So if you can look into that, that is one of them is hair follicle testing, and that tests all the epigenetics. The other one is genomics. So genomics testing is a test of the gene abnormality and their mutation, but it comes with the epigenomes. So Genomes is the genetic abnormality. Epigenome is the epigenetics way or protocol, and that will make you, which is the phenotype, or you will then exercise the epigenetics, make it tight so that the genetics abnormality does not express. One of them is, like I said, the MTHFR is the genetics. So if it's abnormal, then we know. If you haven't had anxiety, stress, and memory loss, you will in the future if you are not aware that your folic acid level will drop, your B12 level will drop. Some of the patient even feel tired and they go into depression. So if you know already the epigenetic, which is, you know, methylated folate and methylcobalamin, which is B9 but methylated, so don't get the folic acid. You will see if you are buying this, okay, they will say folic acid, then don't get that one, because your body cannot convert the folic acid to folate. That's the reason why you need the methylated folate. So it's already methylated because you have difficulties methylating the folic acid and also the B12. But if you get the methylated cobalamin is the best. I mean, many people do not understand the difference, but for people that has MTHFR abnormality, it's a big difference. Okay, so next week is December 17 on Thursday. It's the last YouTube session, and the topic will be insomnia. If you don't have insomnia, great. But if you do, I'll be discussing about insomnia. That can happen to anyone. Our virtual party, Patients Appreciation Party, is this Saturday, December 12th at noon. PST, Pacific Standard Time. Let's join either on the Zoom. I have 100 space there. It will be mailed, how to get to the Zoom. Or you can also access through YouTube just like today. Please follow us on social media, Facebook, Instagram, or YouTube. And if you like the lecture, please give us thumbs up or make a comment if you want to ask questions. Subscribe to my YouTube and share with your friends. And I will see you this Saturday. Thank you so much, Dr. Maria here, Maria Sulindro, integrative anti-aging specialist practicing in Pasadena, California.